So you want to become an ER nurse? Well, let me tell you guys what it really is like. Hey nurse babes, and welcome back to my YouTube channel. My name is Chelsea and I have been a nurse for 5 years. My experience ranges from ER nursing to cardiac intermediate care nursing. I am now an infusion nurse and retired from bedside nursing. Now that we got that out of the way, let's jump right into why you should become an ER nurse if you are having questions about it or if you're trying to decide if ER nursing is the right specialty for you. Again, side note, I am not currently an ER nurse, but my experience is from ER nursing. So I'm gonna be frank and be honest with you guys. The best way to describe ER nursing is when a trash can is on fire and everybody sees that it's on fire and they're continuously walking past that trash can as if everything is fine, you know, nothing to see here. And then meanwhile, there's security guards that are all running to a room because of a violent patient. And then you have staff members that are all running to that room because they want to be nosy. It's just a whole lot of, like, let's just be honest, ER nursing, if you are a nosy person, you love adrenaline, and you're just a chaotic sometimes type of person, ER nursing is definitely for you. And you will never get bored. So ER nursing is a whole lot of anticipating orders. So you're anticipating orders and you're also thinking 3 steps ahead on what exactly that patient's diagnosis more than likely is. So in the ER, you're typically dealing with patients who have chronic issues as well as acute issues, and you're trying to decipher between those two and figure out, is this a chronic issue that they're going through or is this a new onset? In ER nursing, there's also a lot of tasks that need to be completed. So typically, a lot of the ways that you treat a patient are very similar. So a patient comes in with infection-like symptoms or septic-like symptoms. Maybe they have a UTI and you think that it's progressed into pyelonephritis or something like that. You know that they're going to need antibiotics. You know they're possibly going to need blood cultures, things like that. So with the ER, it definitely is quick in and out. So remember that. Be quick and be in and out of that patient's room in a timely manner. Your job as a primary ER nurse for that patient is to get a Cliff Notes. Hence, Cliff Notes, because people love to tell you about their entire life story. In the ER, we don't have time for that. We're here to find out why you're here, what's wrong, what's hurting, when did this start, how long has it been going on, have you seen anybody for this issue, and do you have any chronic medical problems that maybe are exacerbating this issue. So you have a patient who comes into the ER for chest pain. And remember I said quick in and out. With chest pain, you already know that you're going to need a chest x-ray. If it is a female patient, you're going to want to have a pregnancy test done before they get a chest x-ray. Before you even get a chest x-ray, you need to have an EKG within 2 to 5 minutes of that patient hitting the door. So as soon as they come in and they complain of chest pain or abdominal pain for women who are above 35 or 40, I believe, need to have an EKG. Pretty much everybody gets an EKG. Let's just be honest, in the ER, sometimes I feel like we overdo EKGs, to be honest with you guys. But hey, life-saving EKGs are the way to go, apparently. I digress. Back to the chest pain. So when your patient comes in with chest pain, you need to make sure you have an EKG. They need a chest x-ray. If they are on blood thinners, you want to get those levels. So you may want to get a blue top or a D-dimer. If they're coming in for shortness of breath, you may suspect that they have a blood clot. So chest pain, shortness of breath kind of can go hand in hand. A lot of the things that you do for them, the way that you work them up is what we like to say, is going to be very similar. Now, if they have chronic health problems, obviously you may want to order more things. The doctor may take a deeper dive into their medical history. But as a nurse, especially as a new grad nurse, your job is to anticipate orders. So before the orders are even put in, you know that you need blood work. You know that you need an IV line. You know that they're probably going to order aspirin for a person with chest pain. You know that they're going to want a troponin cardiac marker for a patient with chest pain. You know that they're going to want an EKG. You know all of these things. So you don't need to always wait for someone to tell you to do them or an order to be placed. Just go ahead and get it. Just kind of anticipate the orders, but also it helps to make your job easier for you because you may get tied up 5 minutes later and not be able to make it back to that patient had you waited. Does that make sense? Hopefully it makes sense. So for my introverts out there, because I personally am definitely an introvert. I'm more of an extrovert introvert, to be honest with y'all. That's what my husband will say. More of an extrovert introvert, but like, honestly, I'm actually very shy if you don't know me very well. Very shy at first, and then once you get to know me, I warm up, you know? For my extroverts out there, ER, I mean, if you like to talk to people all the time, ER is probably not going to be for you. If you're an introvert like myself, and you like to be quick in and out and get a quick story of what's going on with someone, and you don't really have time to sit there and talk about their granddaughter and what they did the other night and what happened 10 years ago as to why they have the health problems that they have today, then ER is probably going to be for you. Like, if you don't have the time to sit there and fluff their pillows and get them a warm blanket all the time and all that like admission type of caring in a sense, then ER is going to be for you. ER is very quick in and out of a process, and you usually don't have time to establish long-term relationships with these patients. So if you guys are new to my channel and you haven't seen one of my most popular videos, which is about ER nursing and what you should expect as a new grad before you start, I think the biggest thing that I always try to stress to people is that you want to make sure that you're choosing a hospital that has a certain trauma level that you would like to work in. So because the ER is the first place that you see everything, we are the filter, or we were, because I'm no longer an ER nurse, but ER nurses are the filtration system, is what I like to describe it as, of if the patient's going to be discharged or if they're going to be admitted. So with that being said, you want to make sure that you're not signing up for a hospital that is a high-level trauma unit and you're not prepared for that, because it can be a lot. It's a lot on ER nurses, especially if you are a new grad nurse working in a level 1 trauma hospital. You also want to keep in mind that if you do decide to work for a level 1 trauma hospital, you're going to have certain patient population that come in. Especially if you work in the inner city, you're going to have certain patient population that come in versus the suburbs. So maybe in the inner city of Detroit, for example, because that's where I'm from, in the inner city of Detroit, you're going to have a lot of gunshot wounds. That's just what's going to happen. You're going to see a lot of blood, basically. But if you work in the suburbs, you may not see that very often. So if you work in, I don't know, a suburb of Detroit, St. Clair Shores, I don't know. If y'all are from Detroit, if y'all know, we here. If you work in St. Clair Shores, you're probably not going to see that many gunshot wounds because of the patient population. You may see them here and there, like every so often, but you're not going to see them every day or multiple times a day with working in the inner city. So just keep that in mind as well if you work in a city or an area that is heavily populated with more of a poorer population, or if you work in the suburbs where that population really doesn't exist as much. So let's go back to choosing a trauma level. You have, I don't remember how many levels there are. I know there's definitely 3 levels of trauma. I think there's level 1, level 2, level 3. Anything after that is like, I mean, they call themselves a level 4, but it's really not like trauma, you know? Like, trauma level 3s are kind of like soft in a sense. Level 1 and level 2 are your cream of the crop. Those are the ones that are going to be more chaotic. You're going to have a lot of sick patients at that hospital, especially if you work in the ICU or different areas of the hospital. You're going to have more of a sicker population typically than you would probably see in your trauma level 3 and 4. That's not to say that trauma level 3 and 4 don't get sick patients, but you're not going to see them as often as you would see them in a level 1 or level 2 trauma unit or a trauma hospital. So personally, I honestly don't recommend that you work for a trauma level 1 hospital as a new grad nurse because it's chaotic. I've done it. Take it from me. I mean, everybody to each their own. There's some nurses that I know personally that started out as ER nurses in a trauma level 1 hospital, and they are like badass, you know? Me, baby, no. I was like, hold up, pause, slow down. It's too much going on. For me, it wasn't, and even from my experience of watching other people, it's not a conducive way for you to sharpen your skills as a new grad nurse in a level 1 hospital. You may survive, you know, there are some people that do thrive, but from my experience of what I've watched, those people who do survive is because they already had hospital experience prior to becoming an ER nurse, or maybe they were like an ER tech already and they just moved up in that, you know, in that that role as a nurse. So it depends, to each their own, but I say start slow and try not to, walk before you can crawl. I just think that as new nurses, baby nurses, it's just best to kind of pace yourself so that you can sharpen your skills and make less mistakes than if you're thrown into the fire and expected to not get burned, in a sense. Alright, so another thing that you should definitely prepare for before you start working in the ER, especially as a new grad nurse, is learning how to critically think. Now, this is something that takes time. It takes time to get to that. It takes a lot of experience, and personally for myself, I don't think I became as confident as I am now until I would say about a year to a 2-year kind of range as a nurse, and that was before COVID hit. So I think COVID for me helped jumpstart a lot of that confidence for me within myself and within my career as a nurse. But prior to COVID, I had about 1.5 to 2 years of experience, and I really think that it takes within about 1 to 2 years to each person. Everybody's different. Some people it takes 6 months. I don't know. For me, to build the confidence and to rely on myself and to not ask as many questions as I did as a new grad nurse, it took me about a year to 2 years. So a thing that a lot of new grad nurses really struggle with, especially in the ED, because it's very autonomous. You really have to be able to critically think in very serious situations. A lot of new grad nurses freeze up. They don't know what to do. They can't decipher when a patient is going downhill. They don't know that sometimes when a patient's going downhill, it's very simple to reverse that. So it can be as simple as hanging fluids. Say their blood pressure's low, and it's just randomly low. Sometimes hanging fluids can really help. Or repositioning a patient. Say a patient's blood pressure is kind of low and they're sleeping, but they're lying completely flat on their back. If you want to help increase blood pressure, raise the head of the bed. But a lot of nurses who are new grad nurses don't typically understand or have that experience yet to have that knowledge to do those things. It takes time. Don't blame yourself if you don't pick up on those type of things so quickly, because it takes time. So just understand that as my new grad babes out there. So another thing that ER nursing helps prepare you for is prioritizing patients. Again, this also takes time for my new grad nurse babes out there. I will say that working on the floor, especially working on the cardiac step down floor like I did, I learned at a slower pace. And I don't think that I got the experience of thinking really fast and critically unless there was a rapid response situation that was happening. And typically you really don't get that critically thinking experience as fast as an ER nurse will if you started out in the ER, because when you have a rapid response on the floor, you have doctors there and you have your staff members there that are all helping you out and helping you figure out what's going on. Versus in the ER, sometimes that doctor is in a trauma right now, and you could probably find a doctor, but for the first couple minutes, you're going to have to figure out how to finesse it, in a sense, how to figure it out, how to do simple tasks and try and figure it out. So another thing I want to talk about is delegating tasks effectively. I had to take a deep breath for this one, y'all. I absolutely hate it when you have nurses that are lazy and decide to try to delegate everything to your technician. I can understand if you have another patient that's coming to your other room that's a STEMI or an AFib RVR or, a stroke workup, something like that. I get that. Totally get that. That warrants delegating a task like cleaning up a patient that can turn side to side and help you out. That warrants delegating that to a technician. But if you have nothing going on and you just don't want to clean up the patient, even though they are able to assist you, you're the problem. You're the problem, baby. You may not realize it yet, but you are definitely the problem. And you're the reason why your techs are hiding from you. You're the reason why your techs don't want to help you. You're the reason why your techs call you Needy Nancy, because they don't want to be overused. You are exhausting your resources. So please just don't be that nurse. If you're able to do the task yourself, please do it. Just do it. So next, let's talk about continuing education. So as a new grad nurse, you already are excited because you just graduated nursing school, you passed your NCLEX, which apparently they have a whole new next generation NCLEX now. I took that thing 6 years ago. I don't even know what's on that now. But I digress. You're excited, you just graduated nursing school, you took your NCLEX, you got your, your scrubs, whatever the case may be. You got all dressed up for your first day, right? And you think you don't have to worry about school anymore. anymore? Well, you're in for a rude awakening, because every hospital to this day, especially now, it's 2024. Happy New Year, everyone. It's 2024. Every hospital that you're probably going to try to work at, you're going to have a new grad residency class that you have to participate in. Whether you are a new grad nurse to that specialty, or if you are a not as experienced, or you're new to that specialty as a nurse, you're going to have some form of residency that you have to go through. And it typically is about a year of probation that you're on. You have to do quizzes, you have to show up to classes, you have to do certification classes like TNCC, PALS, ACLS, BLS, all of those things. Yeah, it's kind of a strict curriculum. It's kind of like being back in school. A lot of people will describe it as. So just be prepared for that. You're never going to stop learning as a nurse. You're always constantly learning, especially as a new grad nurse. You're going to be on a probationary period, and part of that is from your residency. So let's talk about further education. Y'all know as well as I do, especially if you watch my channel, that I actually did plan on going back to school for NP. But I've since changed my mind, because financially and just as a whole of where my career is going, it's not going in the direction of inpatient bedside type of thing. Obviously now I am an infusion nurse, so my career as a nurse is going in a different direction than I originally thought it was going to go. For those of you who want to go back to school for your NP, use bedside as a tool. The hospital is a business corporation. If you are trying to go back to school for NP and you really want to work inpatient, or you want to go back for your DNP, or you want to go back for education, use bedside as a tool to gain experience and learn more and grow in your career. That's it. Alright guys, I have a couple more tips that I definitely want to point out to you before ending this video. So let's talk about preceptorship. Preceptorship is super important for a person to feel they are in a safe and healthy environment to learn. I personally love doing videos about new grad nursing and as well as nursing as a whole, because I love to teach and I love to promote and instill in nurses that in order to care for other people, you have to learn to care for yourself first. So with that being said, to talk about preceptorship, you definitely want to have a great preceptor all around. I don't like when I have witnessed and seen multiple times, especially in like specialty areas like ER. I haven't seen this in ICU because I've never worked in ICU, but I've heard people tell stories about the ICU when it comes to this. Not every hospital is the same. Not everybody's experience is the same. But I'm going to speak from my experience in the ER. I don't like when you have a preceptor and maybe you guys are clashing. Maybe your personalities are just clashing. You're not really working really well with them. They go and let other people know who are also preceptors that you are difficult to work with, that you are not picking up on the skills as fast as they want you to, you're not doing well. Basically talking about their personal experience with you as their preceptee. I don't think that's okay. I don't know if it's just me, but I don't think that's okay. I don't think that you should be talking about another person and your experience with that person, because now that person has to now train with someone else, and now their perception is going to be skewed because of what you told them. So they're not even going to give that person a chance on possibly being successful, because you've now tainted their mindset with your experience. Does that make sense? So can we just stop doing that? Can we just stop talking about people who are not doing well in their specialty? Like it's an adjustment, you know? It's an adjustment for everybody. If you're new to the ER is not for everybody. It's not for everybody, and that's exactly why I'm making this video. It is not for everybody. It is chaotic and it is stressful and it is violent at times. It's not for everybody. And I'm making this video because I want you to be able to decipher between the two. What specialty are you willing to specialize in as a nurse? What makes it tough for nurses to want to stay in a specialty is when you have preceptors who are bullies and who are belittling you and disrupting your learning environment and like making it chaotic and hard for you to learn in a healthy environment. So let's talk about exposure to violence and conflict in the ER. It wouldn't be the ER if you didn't deal with that. Let's just be honest and frank and upfront. You're going to experience violence and conflict in the ER. You're gonna have to like learn how to stand up for yourself and set boundaries as a nurse, because in the ER you're going to deal with people who are frequent flyers. You're going to deal with people who have mental health issues as well. You're going to deal with people who are not in their best mind when they come into the hospital. The good thing about working in the ER is that you do have security. You do have doctors that are right there if you need them. And honestly, a lot of ER nurses that I've come across, we don't put up with the BS. Like, we are ready to knuck and buck if we really need to. you and medicate patients if it really comes down to it. You also have to figure out ways to set your boundaries and to know safety tactics. Another thing to keep in mind is that depending on what hospital you work at, the one that I used to work at, we use the software system Epic, and Epic had a way of being able to flag a patient's chart if they were at risk of violence. So definitely keep in mind or keep an eye on that. If you do have a patient that flags as a risk of violence, then you may not want to go into the room by yourself. You may want to have a male nurse with you if you do have to go into the room, or just keep the room door open at all times so everybody else can hear if that patient does become violent or aggressive in any manner with you. Lastly, let's talk about stress levels in the ED. I'd be lying if I said that the ED is not probably the most stressful specialty that there is in nursing, in my opinion. You deal with very quick and serious situations, especially as a trauma ED nurse. You see things that the human being probably should never see. There's things that are unimaginable, things that you just cannot unsee. You know, things that a lot of nurses probably have nightmares over. I stress the importance of making sure that your mental health is in check. If your mental health is starting to depreciate or starting to decrease, I believe that as nurses, we need to learn how to care for ourselves before we can care for other people. Alright, so if you guys made it to the end of this video, let me know what your thoughts are based off of what I kind of shared in this video. I know that it wasn't super positive, but hopefully I am being realistic with you on making your decision on if ER nursing is the right fit for you, or if you decide to go into a different specialty, or if you decide to not do bedside at all. That is also understandable. So make sure you guys give this video a thumbs up and subscribe to my YouTube channel, and I will see you all in the next video. Bye, nurse babes.